Rachel Reeves' budget has sparked significant concerns within the healthcare sector, particularly over the increase in employers' national insurance contributions from 13.8 to 15%. This move, while designed to generate more funding for the NHS, has ironically left GP practices, care homes and hospices, many of which are private or charity-run, struggling with rising costs. As Dr. David Wrigley, Deputy Chair of the British Medical Association, stated, the hike's impact on GP practices is monumental, with many already on a financial tightrope due to years of neglect. The concern is echoed by Jeff Butcher, a care home operator, who noted that the increase might lead to a speed of closure of homes, given its effect on operational costs. You know from going into a home how much the carers and the workers there put in and how little they're paid. The criticism largely stems from what healthcare professionals and advocates see as an inconsistency in the policy's application. While NHS bodies are exempt, entities providing similar services but operating outside the public sector, such as GPs and hospices, are expected to bear the brunt of the increased tax burden. The independent care group Mike Padgham expressed dismay, warning that the NIC hike could be the final straw for many small providers already stretched thin. Similarly, Age UK's Caroline Abrahams highlighted that the increase might lead to higher care fees, impacting elderly patients who are already managing tight budgets. The Health Secretary, Wes Streeting, acknowledged the issue, noting the need to shift investment out of hospitals into primary and community care. However, Streeting's assurances have been viewed with scepticism by figures like Helen Morgan from the Lib Dems, who argued that raising NICs without exemption for these essential care providers undermines Labour's broader goals of resolving the GP and care crisis. Morgan stated this new government must not make the same mistakes as the Conservatives, emphasising that investing in primary care to avoid costly hospital admissions should be a priority. Of course, what this will mean in practice is that Rachel Reeves will have to back down, will have to admit that she needs to adjust the budget, and I don't think she's someone who likes to lose face. The issue at hand reveals potential teething problems in the new administration, as Reeves's budgetary approach seems frankly out of sync with Labour's stated objectives of alleviating NHS pressures. It's not out of sync, of course, with her ferocious ideological attack on anything that happens to be providing a private service to supplement the state system. Austerity-era legacies have left GP practices in urgent need of both funding and manpower. And while Reeves's decision may have been aimed at reducing NHS waiting times, the immediate effect on GP and care services suggests a lack of nuanced understanding of these sectors' financial vulnerabilities and the way they're actually now made up, with layers of extra private bureaucracy. Yes, there's a lot of dead wood that needs to be cut out, but this isn't the way to do it. Ultimately, while the increased NICs promise to bring in funds, the lack of exemptions for GP surgeries and hospices could inadvertently worsen the situation. Rather than solving the crisis, the budget risks creating a vicious cycle where overstretched services are forced to reduce staff or close, further straining the NHS and community care. I think, frankly, this is a disaster simply brewing, and only Rachel Reeves can stop it bubbling over.